people die of lung cancer than prostate, breast, and colon combined. We lose over 155,000 people in the United States alone of lung cancer every year. The whole idea behind lung cancer screening is we find these lung cancers earlier, smaller, more treatable, and possibly curable.
It was just a great experience, and of course having a negative result was even better. And I'm so glad that I had it, and I would recommend it for anyone.
A low-dose CT screening for lung cancer is a CAT scan that is meant to be a test to detect lung cancer at a very early stage when it's very treatable and curable.
The idea of the low dose is the patient doesn't get the same amount of radiation exposure that they get with the regular CAT scan.
We're not going to put anything into your body. You're not going to feel any different when you leave than when you came.
The criteria here at St. Anthony's is patients are between the ages of 55 and 74, have a 30-pack history of smoking cigarettes. So they've smoked at least a pack a day for 30 years or 2 packs a day for 15 years. And if they've quit smoking, they have quit for less than 15 years. We have a meeting before they come in, and that's an educational meeting for the patient. We talk about what are the benefits and the risk of the screening, and then what to expect during that CAT scan. The day of your lung cancer screening, you come into the radiology department. You check in with the ladies there. They'll register you, make sure that insurance and everything is taken care of. Then they escort you back where they'll give you the opportunity, if need so, to change your clothes.
Come on with me, we're gonna go into the room for your test today.
Okay.
The technician comes and gets you, takes you into where the CAT scanner is. They'll help you get on the table. They'll slide you into the CAT scanner. They'll ask you maybe to hold your breath for 10 seconds and put your arms up over your head.
It was a wonderful experience. There was no preparation. It took a matter of minutes, and before I knew it, it was over.
Before they leave, I also give them my direct line so that they can call me in case they get home, if they have questions. They know that within about 48 hours, I'm going to call them, and I'm going to call them if we've got good news or if we've got concerns that we need to go further. If they have to see a medical oncologist, I meet them at the office. If they're going to meet one of our radiation oncologists, I'm down here with them as well. If they're going to surgery, I go with them to see the surgeon, and then I sit with family the day of surgery.
If their scan is entirely normal, they are eligible to continue to have screening once a year.
The rate of finding lung cancer with a low-dose screening is usually 1 in 100. So the majority of folks, we are able to call them with the good news that they do not have a lung cancer.
When we detect cancer early, the treatments are higher cure rate and lower side effects. You will have a better chance of surviving and not dying of lung cancer if you have this screening test.
Medicare has approved the low-dose CT scan for lung cancer, and with private insurances, most of them do cover it, but we always call to check if a pre-certification is needed, and if the patient does have some financial responsibility, we notify them prior to the testing.